Good afternoon, my name is Ivan Gutierrez, and this is my presentation on hepatitis A. Hepatitis A comes from the family Picornaviridae from the genus Hepatovirus. It is a non-envelovirus, which means it can be shed in stool, and it is a single-stranded RNA virus. Its replication cycle is not cytopathogenic. It multiplies in the intestinal tracts and is actually pretty resistant in the environment. It can survive low pH, moderate heat, and freezing. However, high temperatures will inactivate the virus. Hepatitis A shows tropism for liver cells. If you take a look at the picture on the left, you can see a healthy liver and compared to a liver infected with hepatitis A. The incubation period is between 2 to 8 weeks. And hepatitis A causes a liver disease. In general, most patients only experience mild infections, but severe clinical manifestations of hepatitis A are possible, and those include things such as fulminant. In the US alone, there are about 3,365 new cases of hepatitis A reported every year. And according to the CDC, the incidence rate for 2010 was 0.5 cases per 100,000, which makes the mortality pretty low for hepatitis A. So now we're going to talk a little bit about symptoms. In general, hepatitis A viruses infections do not lead to liver failure or death, but symptoms could be experienced for up to 6 months. Generally, it takes about 2 to 21 days, or people will, experience symptoms for 2 to 21 days. And the signs and symptoms could be categorized into 3 stages. The first one is called the asymptomatic stage. And then the second one is the pre-icteric period, and lastly the third stage. In the asymptomatic stage, people don't experience any symptoms, but are still able to share the virus in the stool and spread it. In the pre-icteric period, is where you see your most common symptoms, and those include diarrhea, constipation, nausea, vomiting, abdominal pain, malaise, muscle pain, joint pain, cough, fever, among others. So this is like the most common and general symptoms. Once a person gets to the third stage is where you see your more severe cases, and those symptoms include dark urine, pale stools, and jaundice. So your body turning yellow. Hepatitis A is usually diagnosed through a blood test, and this test is looking for anti-HAV IgM antibodies in the serum, which could be detected 5 to 10 days before symptoms appear. Usually, the hepatitis A test is done as part of an acute viral hepatitis panel. So when they're testing for all the hepatitis, usually hepatitis A is included on the test. The only natural host for this virus is humans, but non-human primates have also been infected in laboratory conditions. So who is most at risk? According to the World Health Organization, people with low socioeconomic status, living in rural areas that have limited access to sanitation facilities, that work in high-risk occupation, or are from a specific ethnicity or race, or older age, men having sex with men, and use of illegal drugs or poor hygiene practices all put you at risk of contracting hepatitis A. Here we have a table showing how Mexican Americans tend to experience higher percentages of hepatitis compared to U.S. born Mexican Americans or U.S. born Hispanic white. So we are looking at this line on the top. And on table 5, we could see how hepatitis A is spread throughout the world. Like we can see that high income Asia Pacific adult susceptibility is high, and then Central Asia, East Asia, South Asia, and Southeast Asia, the child immunity is pretty low, and also the susceptibility rate for those countries are extremely low. So it's basically showing that in your more underdeveloped countries that don't have good sanitation facilities, you'd say, have a higher prevalence of hepatitis A. Okay, so how is hepatitis A transmitted? It is transmitted primarily by the fecal-oral route, so meaning you will likely ingest contaminated feces through your mouth. But it could also be spread through personal contact with an infected person, especially if you're performing certain type of sexual contact like oral anal sex, carrying someone, or if you're caring for someone who is ill and has hepatitis A, that also puts you at risk of being infected with the virus. If you are doing using drugs with others, like stated before, in general, hepatitis A is extremely contagious, and people could even, spread the virus before they feel sick. So things you can do to avoid it or to reduce the risk of spreading or catching the hepatitis virus is to practice good personal hygiene. Wash your hands as often, especially after using the bathroom. Wash all the fruits and vegetables before eating them. Avoid raw or undercooked meat and shellfish. And avoid sexual contact with anyone that has hepatitis A. The management primarily is composed of the vaccine, which has to be administered more than once to receive the full benefit. The treatment for hepatitis A, you would say there's not really a specific treatment for it, but in most cases, hepatitis A is treated with immunoglobulin. If the infection is diagnosed before the incubation period, so let's say you get it before you start feeling symptoms or the virus has time to incubate, the vaccine could actually be used as a treatment. And lastly, I just have here a quick summary of hepatitis A. Again, it is a liver disease that spreads when a fecal matter enters the mouth. It may last several weeks, but most people recover completely. Prevention for hepatitis A include hygienic food and water, clean bathrooms, proper hand washing. Some of the symptoms include abdominal pain, vomiting, yellowing of the skin and eyes, which is jaundice, and it's usually spread by direct contact, food and beverages, and poor sanitation, or if you come in contact with infected objects or objects that an infected person handled. That is it for my presentation. The last thing is my reference page. Thank you for taking the time to see my presentation.